Welcome to my channel. Please subscribe, click the notification bell, like, comment and share.
Please sit back to watch this amazing video about infertility with Lola.
Hello everyone, welcome back to my YouTube channel. This is Vicky's Escapades, and on this channel, I don't know if you know my name, but my name is Lola. So on this channel, we promise to always bring you stories and then always bring you, information about different disease conditions and all those things. So today, let's talk infertility. I'm sure you all must have heard about infertility. You know what women, especially in this part of the world, actually go through when it comes to infertility. They are always attaching being infertile or not being able to conceive a baby to a woman. So now we're going to know what infertility is, some possible treatments, let's say, and then the causes, the risks, attached to being infertile and all those things. So what's infertility?
The main reason why we are here. Please watch till the end.
Infertility is the inability to conceive a child after 12 months of constant sexual intercourse without the usage of contraceptive devices. So that is if you've been having sexual intercourse continuously with your partner for continuously for a whole year or even more than, and you've not been able to get pregnant, conceive or anything, so you'll be considered infertile. And there are different causes for men and women that leads to infertility. So but the general causes will be as one ages. I'll talk about age. So in women, once you get to the age of 32, mostly in your 30s, once you get to the age of 32, your
ability to be procreate, that's crap.
But your ability to conceive a baby starts dropping. But for men, it's at the age of 40, the ability to conceive. Not most men, like this just happens in some men and some women, because we all have different body systems, and then that happens. So obesity also is a general thing between men and women that can lead to being infertile. And then what else? Alcohol consumption, smoking, and usage of some medications. Like if you keep using medications like NSAID, non-steroidal anti-inflammatory drugs, it can actually, the constant use, can lead to infertility. All these things are just possible risks, and that can actually lead to one being infertile. And then there are also causes like hormonal imbalance, and maybe delayed menstrual cycle, irregular menstrual cycle can also cause infertility. Yes, I said hormonal imbalance also, yes. And then, underlying medical conditions. I heard that, diabetes also leads to one being infertile. So all these are the causes and risks of infertility. And then for women sometimes, and even men, untreated infection can cause infertility. For men, varicocele, that's this varicose vein, can cause infertility also. And there are different things that can be done. There are lots of tests that can be done for causes of infertility. Let me just chip in other causes, although you can go back and read about this infertility in men and women. So low sperm count is also a cause of infertility. Low sperm mobility and abnormal sperm, maybe there's a problem with the sperm or something, is also a cause, and all those things. So forgive me if I keep looking at this place because I'm trying to look at what I jotted down. No one's an island of knowledge, so yeah. So I learned that endometriosis in women also causes infertility. So those are the causes. So there are different tests for men and women that you can undergo if you feel that I've been having sex with my husband or wife for more than a year and we're yet to conceive. So for men, the tests for men are semen analysis, blood test, ultrasound, chlamydia test. This chlamydia test is for infection. And then the test for women, also blood test, laparoscopy, and there is one that actually gets to me. That's hysterosalpingography, hysterosalpingography. That's the spelling, so you can look that up. So this test actually checks, it's like an x-ray, so it helps to check the inside of the uterus, the womb, especially the fallopian tubes. It helps to check if the fallopian tubes are blocked. So during this test, a contrast dye is passed, into the woman's, through the vagina into, the womb, in order to check, to visualize the uterus properly. So during this period, a woman will actually have this sense of, oh, maybe something is wrong with my fallopian tube. If the woman feels so much pain, if the fallopian tube is blocked, there'll be a whole lot of pain. Although this test naturally is very painful. That is why whenever we want to run this test, we always advise the women to take, pain relief or probably Buscopan before going, like an hour before going for the test, to relieve them of the pain, because the pain is just like menstrual cramp, but menstrual cramp can be unbearable for some people. So these are the the causes and tests for infertility. So I think the possible treatment would be IUI, that's intrauterine insemination, and IVF, in vitro fertilization. So IUI is when sperm is collected and inserted directly into the uterus when one is ovulating. So the sperm is collected and inserted. So this they always wait for when the woman is ovulating, and then the IVF, when they take the egg and the sperm and then they watch it. Then they take it to the lab and just watch the fertilization process before when it matures, they can now put it back into the woman's womb or something. I'm sure you guys can go back to read about it. And then if you're dealing with this kind of infertility issue, now I want to talk to women, because most women actually feel, especially in this part of the world, that's Africa, Nigeria to be precise, once one has not taken in few months into marriage, then the family members will start coming and start blaming the woman, not knowing that even the man can actually be a cause factor to them not being able to conceive in that marriage. So, and all these things affect, even, let me tell you one other thing that people don't know causes infertility. Most people have not really heard about it. So even your diet can actually, imbalanced nutrition can actually lead to infertility, and then mental stress, being stressed emotionally. So that's why if you're trying to conceive, try your best to be in the right state of mind. Eat well, adequate diet, adequate nutrition. Ensure all the nutrients are in your meal, your morning, afternoon, and night meal. Ensure you eat right and eat well. Ensure that you're okay mentally. If you know that there's something wrong with you, because mental stress can affect your sperm as a man, affect you as a woman. You won't just be ready to, conceive and all those things, and you won't know. It will be oblivious to you because you keep thinking, oh, I'm okay, I'm alright. Maybe you've done several tests and you're like, I'm fine, my wife is fine, so there's nothing, and all those things. So I feel like we try as much as possible to always be in a good state of mind. If you feel like you can't help yourself, then get help. There are lots of psychologists that are there. You can go for therapy to help you. And then I want to clear this misconception about when you can't give birth, it is the woman. It's not always the woman. Ensure you're well tested. If you've done all necessary tests, the semen analysis, the blood test, laparoscopy for women, hysterosalpingography and all those things, and then the result comes out fine, I guess it's probably God telling you, just wait for my time. So you shouldn't always be fast to blame the woman, throw blames at the woman because, oh, you can't conceive. So I would really appreciate if this can be put into consideration. You can still, drop a comment and ask me more questions. and then I'll be glad to deliver, answers to your questions. Although it would be so nice if you need more, because then another thing is Google can be so scary. You can go on Google and then they say lots of things and then you get scared. So always get professional advice. You have an issue, get professional advice. Don't just assume things. Visit your doctor. You can talk to a nurse if there is no doctor around, a registered nurse. Get professional advice. And I tell you, you'll be fine within no time. But I pray for those going through this infertile issue that God will help you and see you through. And very, very soon, you're going to conceive by God's grace. So, thank you so much for this. I'm so glad that you could tune in today. I hope, expect more of me, because I'll be coming in hot. So thank you. Do not forget to subscribe to my channel. Please subscribe. Please and please and please, I need you to subscribe. After subscription, don't forget to like, leave a comment. I will respond to all comments. I promise. I will try my best to respond to all comments. Then please share so people can, get to know what we're talking about. And if you have more questions, why not just ask me, and I'll be glad to reply and respond to your questions. And aside that, do not forget to turn up notifications so that you get notified when we drop any video, so you won't be left behind. I've told you, jump on this bus with me. Let's go on this journey of knowing lots of things, a whole lot of things. God help us to know more. Yeah, thank you so much. Don't forget to subscribe. Bye. See you next time.
Thanks for watching this video. Please like and comment on it. And don't forget to click the subscribe button.